As it's 2022, this year, the Women's Day, and the main agenda behind the Women's Day, the main slogan that's being used all over the world, it's called Breaking Bias. Before we get into a very, very interesting conversation with some amazing women that we have lined up with you today, I just want to introduce myself to everyone who is hearing us or seeing us. My name is Dr. Sara Saeed Khurrum. I am the CEO and co-founder of Sehat Kahani, a predominantly female health provider network that connects patients to online doctors within 60 seconds for quality, affordable, and accessible healthcare. Sehat Kahani has been working for the last 5 years and have provided over 700,000 consultations to patients in Pakistan from low-income communities as well as from corporate and consumer segments. I'm extremely humbled to have this session today with Jubilee Life Insurance, who's one of our esteemed partners, one of our major corporate partners, through which we provide health services to around 1,000 plus corporations and 7 million lives. And we've done over 40,000 consultations till date. And I think being a company that is led by a female and engages a large network of female doctors, I'm extremely excited today to be hosting this panel along with Jubilee Life Insurance. As we talk about breaking bias, I think there's a very interesting conversation to happen within our panelists today. One of them belongs to a leading position in the corporate sector, and one of them is an amazingly dedicated and nurtured doctor. So if Tazeen, Shahid, can you please introduce yourself, and then we can have Dr. Maryam introduce herself as well.
Thank you so much, Dr. Sara. I'm really excited to be here today. My name is, as Dr. Sara said, Tazeen, Shahid, and I head HR at Jubilee Life. This topic is very close to my heart because I truly believe that women in Pakistan, at least, need all the support that we can get in terms of in terms of having careers or in terms of having healthcare, education. So really, really excited to be part of this discussion.
Thank you, Tazeen. I know you're a very, very busy individual. Being the Chief of Human Resource at Jubilee Life is, I'm sure, a very, very engaging and time-taking job. So I'm thankful that you have joined the session today. Dr. Maryam, if you can have your intro as well.
Assalamu alaikum, everyone. Thank you so much, Sehat Kahani, for having me here. My name is Dr. Maryam Kamal. I'm a psychiatrist and I've been working with Sehat Kahani for almost a year now. I am an alumni of the Howard Medical School for the Global Mental Health Program in Trauma, and I've done my master's from the Cardiff University in Psychiatry. So that's about it. I have over 8-year experience in psychiatry practice.
Thank you, Dr. Maryam. Thank you. As the audience can see, we have a panel of very accomplished women joining us today. So I'll start with you, Tazeen. A question that has been there, and I think this is a global issue. There is an extremely low representation of women in the corporate sector and negligible representation in leadership positions. Why do you think that is?
That is a very apt assessment, Dr. Sara. Yes. But what I'll get into the reasons or the broader reasons why that is. But let me just first start off by, the kind of discussion we're having right now. We never envisioned having this discussion maybe 15 years ago, because 15 years ago it wasn't even, at least in Pakistan, this issue wasn't even tabled that there is a need for women representation in the corporate sector. Nor was the discussion ever, it didn't happen that we needed women in leadership positions. But now both the discussions are focused or at the center point of a lot of organization strategy. We are, in terms of getting women into the corporate sector, the percentages are not so bad. They're pretty encouraging. Women, they represent 50% in our education institutes. Students are women students. They graduate and they do join the workforce at least as well. But the issue happens that when they progress in the organization and when they reach mid-career levels or few years down after they start their career journey, certain life changes or certain changes happen, because of which a lot of them fall through the cracks. This is where organization needs to work, and a lot of organizations are working. So this is why we see so many women fall through the crack, and they don't progress their career to attain the leadership position. And there are hardly any cohesive or robust returnship programs which offer women who maybe get married, have children, and they want to maybe join back. I know so many of those accomplished women who want to join back. They want to have, because once the children are a little independent, they want to join back, but nobody is willing to give them the opportunity. So this is why I believe that there is so little representation in the leadership position. And a lot of onus or a lot of effort needs to be made by employers, organizations, because we are potentially losing a big chunk of talent, and it's a wide talent pool which we can tap. So this is what I believe is the reason, because a lack of support, flexibility offered by employers or organizations, which is the reason why we see so many women stop working altogether.
Tazeen, I can so echo that, because one of the key motives that we started Sehat Kahani was that a lot of female doctors don't work after marriage or responsibility. 80% of the medical workforce is made up of female doctors, but only 40% of this number enters formal practice. And a lot of women fall through these cracks after years of hard work getting a medical degree. So that brings me to you, Dr. Maryam. How do you see the bias in the medical workforce, specifically for female doctors?
So basically, when we talk about bias, let's talk about the very basics of bias in terms of psychiatry and psychology as to why bias develops in the first place. So we call it the implicit bias. Implicit bias is something that has already been ingrained in our brains and mind, in our way of thinking. It's kind of like ingrained in our genetics, in our DNA. And the way we think is kind of like a part and parcel of our culture, our society, our traditional way of thinking. And so when we talk about, our thinking processes, they're basically based on how we define gender. So our thinking processes in research, it is about how we consider genders in different roles. So when we talk about gender, male and female have very defined, very strict gender roles in our minds, in our schemas, in the way that we think and the way that the society sees us. So when we talk about that as a woman in a specific role and man in a specific role, for example, how do these biases and schemas develop in the first place? For example, a small kid who is brought up in a very traditional environment would see his mother taking care of the house, taking care of the children, and he would see his father going out and taking care of the business outside or working outside. So these are the two lines, these are the two bases as how he would like to interact with the world outside, with the females and men. And this is just the basic. It can change. It is very challenging to change the mindset and the schemas and the way that we think and process, which then translate into our behaviors and the way that we treat other people. So coming back to the medical force, times have changed. We are in the 21st century, and I wouldn't say that it's very different in the West or the East. It's very universal. Women in the medical field are equally as competent, we know, and being given equal opportunities. For example, if you would look back 50 years ago or 60 years ago, what happened was that we used to have specific seats for women. The ratio would be 2-8 or 3-7, for example, in the medical colleges themselves. But now everything has changed. Everything is based on competence. You would be amazed to know, and everybody kind of knows that females take more medical seats when the medical admissions to colleges are taking place. So there is an equivalence of competence. We see women doctors as equally competent. But the problem is when arises in bias when they get married and the priorities change. Yeah, I wouldn't say it's a bias, but it is a priority that changes. The women are expected to take care, bear children, take care of the children, take care of the house. And then, for example, their profession gets stagnant. It's not about being allowed, it's just that they have a hindrance, a barrier towards their medical profession. They can't pursue it. Majority of the women doctors in Pakistan or the third world, and that's a story that you would hear very often, and that's where Sehat Kahani comes in and helps out. Correct? So this is the kind of environment that we are in. But when you look at the middle management in the health sector, you would see a lot of women, right? You would see them progressing. You would see a lot of health workers. You would see a lot of nurses. They're all women. So I wouldn't say that there is a bias in that sense, because we have in our mind acknowledged that if there is a profession for a woman that she needs to pursue in our culture, traditionally would be either teaching or it would be becoming a doctor. But now, of course, times have changed, and the barriers have been broken, the traditional mindset has been broken, and we see women in a lot of fields right now, especially the corporate sector.
Thank you, Dr. Maryam. I think that was very insightful. I think in the last, Dr. Maryam said that there's a confidence crisis in women, and that I think can be a little similar to imposter syndrome as well, where many women start believing that they're not good enough for the position. And this is just one of the biasness that creeps up in a workplace. But in your experience, what are the common biases that you have seen against women who work or women who practice?
Okay, so Dr. Sara, what my experience has been, and I've done a lot of research to come up with programs that help women progress in their careers. So when I say that our society generally, I'm not talking about exceptions or I'm not talking about minority, but generally the way we raise girls, inevitably they lack a bit of confidence. They always second guess their own decisions. They always look up to a male guidance or role model to back their decisions. It can be father, brother, or later on husband. So that is there. But what the biggest bias that I feel that happens in the corporate sector is that once a woman or who's a professional has gotten married, even then it's fine. Now people expect her to continue to work, but once she has kids, now that's a different set of ball game right there. Then the perception comes in that her time will be divided and she will not be as focused on her career as is required. And on the flip side, for women, what happens is they start feeling that they are not doing enough. Hence, the lack of confidence comes in. This is where they feel that maybe they were not up for that promotion, or maybe they are not entitled to this role because they are demanding some flexibility. And I feel that the crux of the matter is that men and women are different. They have different needs and they have different life goals as well. If I talk about women, flexibility is something which is not a favor. It is the requirement or a need of the day, because women bear children, and yes, they need to nurture those children. They need time for their children. So it is not something which an organization or an employer or a manager should look at the particular woman professional as a favor, because as long as the work gets done, if she gets the support, I think that the confidence would come back. Just recently, I keep in touch with women professional across industry. So I kind of like doing that. So we've been having this discussion that maybe there was some promotion case, and I'm telling you a live case that the lady in question thought that she didn't deserve it, but I keep going back to them and tell them that they have earned it. Even if flexibility, if they have taken the flexibility, they have given the result. So what I'm trying to say here is that the lack of confidence is more of a pressure, external pressure. And if we create the environment which help the women grow and deliver, that lack of confidence will be addressed as well. So at the end of the day, I still strongly believe that women, in order for her to continue her professional journey, she needs to get support from, home and employer. Yeah.
Absolutely, absolutely. And Tazeen, just carrying on with that, because I can so relate to what you said, that a lot of women actually think that they don't deserve the kind of work that they're getting, the kind of promotions that they're getting. And I think this is relating it back to Sehat Kahani's story, because Jubilee has also partnered with Sehat Kahani, which is a female-led enterprise that is giving an opportunity for so many female doctors to come back to work. How do you feel sitting at the head of human resources, partnering with a company like Sehat Kahani? How do you think it changes the narrative overall when an organization as large as Jubilee joins hands with a younger company with a particular focus on removing this bias of female doctors not working?
Oh, that is fantastic, Dr. Sara. When we started this initiative, and even if we take the the gender issue aside for a minute, just the fact that the healthcare is accessible to everyone and so easily accessible is something wonderful. And that it's an all women organization, or you have a lot of female doctors who if this platform maybe wasn't there, might not have practiced, is also something which I believe that we're contributing in such a positive way if by partnering with you guys. Because if we make 49% of the population of the country, and that huge chunk of population is not given the opportunity to continue contribute in the economy, then the country will never be able to prosper. So it's really wonderful what you guys are doing. And as I said, gender aside, just the fact that healthcare is easily available to everyone, and so and a quality healthcare at that is just fantastic.
Thank you, Tazeen. I think that's very heartening. And as always, I always mention whenever I present Sehat Kahani's journey, I think I say in very fond words that it takes a lot for organizations such as Jubilee to set the trend for innovation within their organizations. And I'm sure that it is and it will continue to change so many health journeys for Jubilee customers and the corporates who are there in line with Jubilee, who are using Jubilee services. So Dr. Maryam, good to have you back. I think you can touch upon a very important part of the conversation as well. A part of the conversation that we always take along when we discuss biases, and that is the issue of female doctors not working, and also how telemedicine is helping these female doctors to come back to work. You are one of the prestigious doctors at Sehat Kahani that provides mental health services on the platform. How do you think the experience has been, and do you think this is something that can be taken up in the long term by doctors in general, and specifically female doctors?
This is a very important question. It's a very timely question. Telemedicine in this era. So, because of Corona as well, this was something that has been encouraged. Telemedicine has taken leaps and bounds internationally when it comes to practice. So, telemedicine was used not only initially in the war areas in Afghanistan. That's where the American military started using telemedicine 30-40 years ago. And now, because of Corona, it has become an industry which is very, very substantially used throughout the world, and it's very universally accepted. So what has happened in Pakistan is that we see Sehat Kahani, for example. So Sehat Kahani has an initiative of bringing back the women force, the medical force, back to getting their journeys back into their medical careers. It has kind of revolutionized the way that medicine was seen for women who were married, who were sitting at home, per se not pursuing their careers any longer. So what telemedicine did was, gave the women the opportunity who were just sitting at home and they needed a platform to get back to medicine. So in their comfort zones, sitting at home, taking care of their kids, holding the fort for the men, and yet practicing and helping their country and helping people from all over Pakistan, from the tribal areas to the cities to the urban to the suburban areas, everywhere. So women not only have access through telemedicine and Sehat Kahani through the urban areas, like major cities, but throughout. And Sehat Kahani has done a lot of work in that manner, in that fashion, and it's been amazing. So number one, they've given Sehat Kahani and telemedicine has empowered women. They are able to practice medicine. But then again, for women in a traditional society like Pakistan or a third world country, like other countries in the third world, when you have access to security and you have access to health, that is giving women empowerment. So they know, women in Pakistan now know that they can sit at home and they can access health. And they can talk to all the lady health doctors in any speciality. And that's not enough. They have access to all the international doctors. For example, we are sitting in international countries outside Pakistan, and yet they have access to us for all the specialities, for all the healthcare advice that they need, for all the mental health advice that they need, and they can access us anytime. So this is like giving empowerment to the women to revolutionize again and take up their journey in medicine for all the lady doctors who are sitting at home. And then empowering the women of Pakistan to have access to health with the click of a button or the click of the app. So in that way, I would say Sehat Kahani and telemedicine in general has revolutionized the health sector.
Thank you, Dr. Maryam. Thank you. Tazeen, I'll come back to you. I'm sure there are a lot of things that are changing in the corporate world. What do you see? This year is the theme of breaking bias. Do you see a theme getting more positive next year onwards? What do you think is happening now? How is the culture changing across corporations? What are the positive trends that we see? Because I believe that we should always look at the positive and hope for the best. So what do you think the good is happening that you see around you?
So Dr. Sara, the way I look at it, one thing COVID has taught us is that the world is connected. The news travel faster than the blink of an eye, and what happens in one part of the world inevitably impacts the rest of the world as well. So a lot of best practices, since we are so connected now, a lot of best practices which are happening in the West or elsewhere in the world, I think that in Pakistan and corporates in Pakistan are very quick on the uptake. We have quickly actually adapted ourselves to undertake digital a lot of offerings like learning and flexible working and telecommuting, and all of these things maybe were very common in multinationals because they had exposure to that. But for any local organization, it was unheard of that people would be given the flexibility or they would be able to telecommute. But the pandemic came and people adapted. So the same goes for other biases. Since people are now talking about it, it is coming to the surface. And I'm just not talking about bias for related to gender. There's so many biases that we have we face in our daily lives. It could be gender, it could be anything else. So but the thing is that it's at the table and people are talking about it, and once you address it and you talk about it, then then somewhere somebody is going to realize that this is not on, and that's how change happens. So I believe that corporates are very, very quick on the uptake now, and we are looking at what can be done, because at the end of the day it is for everybody's benefit. It's just not for the employer's benefit, it's for the employee and the employer's benefit. If we have productive culture, if we have good working environment, if we are able to tap in talent which was previously not tapped, and if we progress together, so I believe that a lot of positive is there because of the reason that we are so connected and we are ready. We are ready to look at things differently.
Yeah, I absolutely agree. And I think technology is such a great equalizer. Connectivity is really changing the world. since this the collaboration between Jubilee and Sehat Kahani is extremely crucial for patients, but I think especially for female patients, employees, families, their dependents who have women at home, elderlies. So many things are just inaccessible by the female gender in Pakistan today, and I think one thing that this collaboration allows is also a woman in the family to put her healthcare as the front face as well and get connected to a doctor whenever she wants or whenever she has the time. Because I think autonomy in health decision making has also been a very big issue for a lot of women in Pakistan. What would you want to say about that? How would you share this experience of giving the autonomy of decision making to your partner organizations, their employees, and their families?
A lot of work has been done, or a discussion has been had on financial inclusion, of including women in the financial sector. But I have yet to hear a discussion or a topic where you include women in the healthcare, because that is something which wasn't even, nobody thought about it. But now with Sehat Kahani, I totally agree with you that a big portion of a big section of women in our society, they rely on their men folks or somebody to take them to the doctor or to take them to the hospital or to take time out for their healthcare needs. But now that with our customer base and with our partnership with Sehat Kahani, the thing that the idea that we have offered this convenience to women. It could be my employee, it could be somebody in the home of the policy holder or any of a corporate customer. But just the fact that she can actually access healthcare, as you said, at her own convenience and whenever she feels like it or whenever she wants to, is very liberating.
Thank you. I'm happy that you feel that way. Tazeen, as we come to a close, there are a lot of aspiring young females looking at you today, and you've accomplished so much. You've come to the top of the ladder in the organization. Is there any message you want to give to them? Anything you want to add in the end?
Yes, I do. First thing first, a woman's career is never linear, whereas a guy's career usually is linear. They just start off and they keep on going. There are hardly any breaks. So it's okay to take breaks, but never give up on yourself, and never ever think that you don't deserve this. And third thing is that you need to be financially independent. I cannot emphasize this enough. It is for no other reason. It is not for any women's right or for any kind of. It's just that it is a basic human right. And all I want aspiring women out there to put in the work, because you'll be required to do a lot of work. It is not going to be easy, but do put in the work because the reward is so worth it. And it's going to get tough. It will get tough. I have kids and I'm married, and it was tough when my kids were younger, but now my kids are older and I have the independence as well as time that I can focus more on things that I want to do. So you will get there. So just keep at it. Do not give up.
No, thank you. I think this is the best message to be given, because a lot of women give up very early, and it's not because they're not strong enough. It is because they just value one thing over the other in that period of time. So I really loved your message. Dr. Maryam, as Tazeen said that, don't give up and keep on at it. Women are great multitaskers, and they're able to handle a lot of emotional turmoil better, as research says as well. But it does take it does take a toll on your mental health. And since you are from this field, what is the message that you want to give to the woman who's watching this for her health and well-being, and especially for her mental well-being?
Thank you very much. This is a very important question again. Through telemedicine, I would say that women are becoming more aware of the fact that their mental health is important. Through the mental health department of Sehat Kahani and the awareness that Sehat Kahani is providing, Mental health has been the core of medical practice for Sehat Kahani. And now we see a lot of women talking about their mental health, especially. Why is that? Because as you said, women in Pakistan and generally universally, they are multitasking. They're taking care of their homes, they're taking care of their kids, they're emotionally available for their husbands, for their families, for their in-laws. Yes, they're holding the forts for the husbands while they work outside, and these women are sitting at home doing everything, right? And of course, that takes a toll psychologically and psychologically on them, not only mentally, but on their physical. Stress, even simple stress translates into a lot of physical manifestations that they're not aware of. But now I see a lot of young women who are sitting at home, who are aware of mental health, and they're like, yes, I need to talk about it. So as long as women know that they're talking about their mental health, they're seeking support, they are saying no, learning to say no, and forgiving themselves, right? And to talk about their issues with not only your family, but your friends. The thought process needs to change. And I see a drastic change in their thought processes. They are coming up with their problems and they're seeking help. So the biggest message right now I can give women in Pakistan is that celebrate yourself, because you are holding the fort for everyone, and there's so many people involved in your lives who are dependent on you. So you are the heroes of Pakistan. The workforce, the women in workforce, be it working outside or sitting at home, celebrate yourself, celebrate your womanhood. Be emotional if you want to be yourself, and learn to set your priorities and your boundaries. Thank you.
Thank you, Dr. Maryam. I think that being kind to yourself is extremely important. I just want to thank both of my panelists today. Tazeen, I had a wonderful time chatting with you. I think this is the most fun I've had moderating any session. So thank you for being there. Thank you for being so kind about the little wait you had, but had a lot of fun talking to you today. And thank you for sharing your honest views regarding the slogan breaking bias that we're talking today. Dr. Maryam, thank you for carrying on. It was a pleasure having you as well, and sharing your insight regarding how telemedicine and digital health is being fruitful to a lot of women in Pakistan today. So I guess this is it from our end. Thank you for the audience who listened in, and thank you to my awesome panelists as well.
Thank you very much, Sehat Kahani, for having me over for a very important and timely discussion. Dr. Sara, Dr. Tazeen, and on behalf of all those women in Pakistan who work, women doctors working in Pakistan in Sehat Kahani, more than 6,000 of them. And a big thank you on behalf of all the doctors who are outside their countries and who have given us the opportunity to actually take care of our patients back home in Pakistan. So from all of us, a big thank you, and hope to be a part of, continue to be a part of the Sehat Kahani workforce. So thank you very much.
Thank